My name is Dr. Carmen Diaz-Burney. I'm a psychiatrist at St. Luke Bethlehem campus. I do consultation liaison and I follow patients in the partial hospitalization program. Schizophrenia is a chronic illness that have a prevalence of 0.3 to 0.7% in the population. 1% of the population around the world can have the probability to have schizophrenia. The age of onset of this illness is in the teens, the late teens, or early 20s. The symptoms of schizophrenia are, number one, what we call positive symptoms. They are delusions, hallucinations, disorganized thinking, and they can be also aggressive behavior or catatonia. We also have the negative symptoms, abolition, meaning that they don't have any motivation to do anything, anhedonia, poor eye contact, poor concentration, among others. The patient need to have at least 2 in the group A, and they need to be at least for 30 days straight. The patient also need to have at least 6 months of disease to have been diagnosed with schizophrenia. Treatments are, number one is medication. And the medications are different categories. We have psychotropic medications that are called PO, meaning oral medication. We also are injectable, that are long-acting medication from 15 days to 30 days. And most of the time we use that one for patients that have poor compliance with the treatment. That is a big issue for the schizophrenic patient, the compliance. A lot of them don't believe that they have any illness. Sometimes the family doesn't believe that the patient have any illness. And most of these patients ended up in psychiatrist units against the which in 302 commitment, meaning involuntary commitment for the state of Pennsylvania, because they don't understand and they don't have insight in the illness and they need treatment against the witches. Other treatment is therapy, also work for these patients. Another one that they have been using today is case management. These people help these patients outside the services and take them to the appointment and be sure that the patient have medications. One of the biggest problems with this population is that a lot of this population are homeless, they don't have services, they don't go to the appointment, and it's a big cycle. And unfortunately, a lot of them ended up in jail, secondary to aggressive behavior, and be treated there after they close a lot of long-term facility. Bipolar disorders has a prevalence of 6% in the population. The age of onset of bipolar is considered as in the 18, and the sex rate is 1.1 to 1%, more similar to schizophrenia. The difference is that in bipolar disorder, 30% has some severe impairment, and 70% are people that can function in the community. The symptoms of the bipolar disorder is, number one, you need to have a manic episode. A manic episode is elevated mood, irritability, expansive behavior, increase in goal-direct activities, that people have increase in sexual activities. Unfortunately, sometimes they go to so very risky, and some people have been hurt because of that. Also, people have one tendency that they don't sleep. They sleep 1 or 2 hours and they feel very rested. They also have a lot of energy. They are very talkative. They are flight of idea. And all of these symptoms make the symptoms of manic. The other spectrum of the bipolar is the depression. Person has depressive disorder that lasts at least for a week. They have poor sleep, poor concentration, anhedonia, meaning they don't have any feelings, they don't enjoy anything any longer, and unfortunately suicidal thinking can be in the picture, and suicidal attempts, and some people commit suicide. This is the other part of the spectrum, and it's very important to make the correct diagnosis because the treatment is very different. That a lot of people are able to function and they respond very well to treatment if they follow the treatment. And a lot of people, fortunately, they can have a family, they can continue with the children, they can finish education, and they can be very high functioning, different than schizophrenia. The main treatment here practically is medication. It's called mood stabilizers, and They don't respond to therapy when they are in the manic state, but they do respond to individual therapy or group therapy better when they are in the depression state. And unfortunately, that is when the situation happens, and 15% of these patients commit suicide at the end.